Great. So we are streaming live on Facebook, and I'm going to get started with our introduction. First, a quick accessibility note. We have provided ASL interpretation for this event. The interpreter is listed as such and is Spotlight, so you should be able to see that on your screen next to the slides. We also have closed captioning enabled. In order to access that, you should go to the bottom of your screen and click on Live Transcript and click on Show Subtitle. And I'm going to put those instructions in the chat as well once I'm finished with my introduction. So again, welcome everyone. We're really excited to have you all here for our introduction to dialectical behavioral therapy. Hosted by NAMI-NYC and Coordinated Behavioral Care. My name is Clara. I'm going to be doing a quick introduction to NAMI-NYC, the National Alliance on Mental Illness of New York City. And then I'm going to turn it over to our wonderful speakers. So NAMI-NYC, we are based in New York City, but we have been providing services over Zoom for the last year and a half. It's really exciting to me to see all of the different people from all over the US and all over the world, it looks like. I'm seeing people from Brooklyn, which is right next door, and I saw somebody from Puerto Rico earlier in the chat, from the West Coast, from the East Coast. We're really excited to have you all here. NAMI-NYC is a grassroots mental health organization whose mission is to provide support, education, and advocacy for all individuals and families impacted by mental illness. We provide free support groups and classes, currently over Zoom, but hopefully soon in person as well. And we provide groups and classes both for people who are dealing with their own mental health issues and also for people who are supporting somebody in their life who is struggling with a mental health issue, whether that is a family member, a friend, a loved one. We know that it can be really challenging to be part of somebody's support network, and we want to make sure that that folks who are providing that support get support for themselves as well. All of our groups and classes are peer-led. So our support groups for people, for example, living with bipolar disorder are facilitated by people living with bipolar disorder. Our support group for parents of children and young adults is facilitated by parents. So we're really trying to create a space where people can talk about their experiences with other folks who have gone through something similar, and where people can learn from other people who have gone through experiences similar to their own. You can find out more about all of our services by going to our website, NAMI-NYC.org, which I'm going to put in the chat as well. Definitely check out our calendar. That's where all of our groups are listed, as well as events like this one. And you can also call our helpline, which is open 10 a.m. to 6 p.m. Monday through Friday. That number is 212-684-3264, or you can email us at helpline@NAMI-NYC.org, and that will be available in the chat as well very shortly. All right, without further ado, I am going to turn it over to our wonderful speakers. Dr. Bianca Nguyen is a psychiatrist dedicated to social justice and improving access and quality of behavioral health care through partnership, education, and innovation. And Emily Grossman has worked in mental health for over a decade, beginning on the front lines as a peer specialist in community mental health in New Jersey. So we're really happy to have you both here, and I'm gonna turn it over to them.
Thank you so much, Clara, and good morning, everyone. I'm sorry, good afternoon, everyone, depending upon where you are, I should say. It is afternoon here in New Jersey, where I am presenting from, and I know it's afternoon for Dr. Nguyen, who is in New York City. So it's so nice to see so many see so many people type in from around the country and around the world. That's thrilling. And we're so excited to be here. We can go to the next slide. Okay, so my name again is Emily Grossman, and I direct the Coordinated Behavioral Care Training Institute. And I want to read a little bit about CBC for you all. And then I'll tell you a little bit about the Training Institute, and then we're going to get started and kick this off. So Coordinated Behavioral Care, CBC, is a not-for-profit organization dedicated to improving the quality of care for New Yorkers with serious mental illness, chronic health conditions, and/or substance use disorders through a health home, an independent practice association, and other innovative programs such as preventative case management services. We seek to create a healthcare environment where New Yorkers, especially those most impacted by social determinants of health, receive coordinated, individualized, and culturally competent community-based care that's effective in preventing and managing chronic physical and behavioral health conditions. And I want to promise you that these are the only 2 slides that I'm going to read off of. But these are just our intro slides. So the rest of the presentation is going to be much more interactive. So the CBC Training Institute provides innovative, interactive, culturally sensitive training and professional development to New York State's mental health providers. With an eye on adult learning theory, our trainings are cutting edge and delivered with compassion for and understanding of the complex demands on mental health professionals. It is our mission to ensure that we provide evidence-based training on a variety of topics to assist providers in supporting the service recipients on their caseload. With a love of learning ourselves, we create our trainings to be the scaffolding upon which a successful, rewarding career of service can be built. So although most of our trainings are solely for mental health professionals, this training today is really for all of you. And I come to you all as a person. I am a training director, but before that, I am a person with lived experience of bipolar disorder. And a person who has received DBT myself, and a person who's very enthusiastic about it. And so I just hope, before this training started, I was just saying, I just hope that this touches at least one person, where one person decides, I want to try this DBT thing based on hearing our presentation today. So we're gonna go on to the next slide. And we really decided today, and this was Dr. Nguyen's idea, that we were going to start with a mindfulness exercise because some of the skills in DBT are around mindfulness. So I want to invite you all. I know we're not together, but I wish we were together. So we're going to try to pretend we're all together right now. And I want to invite you to do this mindfulness exercise with us called tuning into stillness. So an effective way to develop inner calm is to place your attention on something already calm or still. It could be a tree or a cloud or an item you have on your shelf, like a calming book cover or a painting nearby or a sleeping animal. I have 2 animals, so I'm going to look at a sleeping animal because they are both asleep right now. And I want to invite you now to find that object, just locate it in the room. I'll give you just a second to do that. Okay, and once you found that object, I want you to really notice the details of the object. What does it look like? What color is it? What details define it, such as smooth edges or a calming pattern, or in the case of my 2 cats, they're very furry. When you notice your mind start to wander, which it will, that's part of mindfulness, say to yourself, Right now, I am just looking at the object that I'm looking at. So right now, I'm just looking at a book. Or right now, I'm just looking at my cats. I want you to continue studying the object as if it were going to draw, you were going to draw the object. So pretend you were going to pull out a piece of paper and draw this object, really study it. What do you notice? What parts of you experience and feel still or relaxed as you make a decision to rest your mind there? And I want to invite you now to take 3 deep breaths, still staring at the object. 1, 2, 3. And then I want you to come back to the present, to our training. Thank you so much.
Thank you, Emily. And hi, everyone. I'm so glad to see, I'm just counting the participants. We have over 440 people on our call right now. And I just imagine 441 of us sitting scattered across the world, tuning into something in our rooms. And that is such a beautiful image to conjure up. I have to say, this is my 3rd time presenting with Emily, doing this exact presentation. And I think it's selfish on my part because I supremely benefit from this mindfulness exercise every single time. So as always, Emily, I feel much calmer, and I'm so glad to be ending my day with this and with all of you. All right, so we're gonna dive right into things. I will be speaking during the first half, and Emily will take over for the second half. Just to give you a bit of a picture of what we're talking about today, you are tuned in to a session on DBT, or Dialectical Behavior Therapy. For those who might have missed it, I'm coming from the background as a psychiatrist. Emily and I work together in the same organization, and Emily is a peer specialist and incredibly just a huge expert and with personal lived experience with DBT as well. So I'm going to kick things off by giving you a little bit of history around the development of DBT. I'm going to provide just a quick evidence base to give you an image of what this can be used for and what it can be useful for. And finally, Emily will really take the second half and walk us through each of the 4 modules and big buckets of DBT skills and apply a personal perspective to it. And it's very hands-on, very concrete. And I think that many of you hopefully will find it useful. So getting into the history and development of DBT, before I move on to the next slide, I did want to give everyone or offer everyone a content warning. There will be mentions of self-harm and suicide on the next slide. So I just wanted to let you know that before I advance the slide. All right, so this is an excerpt from the New York Times. This is an article that was written in June 23rd of 2011. And I'm just going to read the excerpt here. This woman pictured here is Marsha Linehan. The excerpt says, Marsha Linehan arrived at the Institute of Living on March 9th, 1961 at age 17, and quickly became the sole occupant of the seclusion room on the unit known as Thompson 2 for the most severely ill patients. The staff saw no alternative. The girl attacked herself habitually, burning her wrists with cigarettes, slashing her arms, her legs, her midsection, using any sharp object she could get her hands on. This woman goes on 10 years later to get her PhD in psychology at Loyola in Chicago. And she is the founder and creator of what we're talking about today, which is DBT, Dialectical Behavior Therapy. So this comes directly from her own personal lived experience. So DBT evolved from really her efforts to try to find a treatment for other individuals like her. And those were individuals at the time who were given a diagnosis of borderline personality disorder and those who struggled with long-term suicidal ideation. As part of her PhD program, she studied many different types of therapies and tried to apply all of it to the specific group of people. She looked at cognitive behavioral therapy, otherwise known as CBT, and then other evidence-based treatments for disorders that we know of as anxiety and depression. And the initial research that was actually done, she found that focus in these CBT sessions was so much honed in on trying to change thoughts and behaviors, very rigidly so, to the point where patients and clients felt criticized or misunderstood or invalidated. And due to that, they ended up dropping out of treatment altogether. So retainment and engagement really was not happening in these traditional models of care. And so what Dr. Linehan proposed is to really shift the treatment so that therapists who are working with these clients could convey acceptance of the patient, and by doing so, help the patient accept themselves. The excerpt goes on to say, and this is a quote from her, "My whole experience of these episodes was that someone else was doing it. It was like, I know this is coming, I'm out of control. Somebody help me. Where are you, God?" she said. "I felt totally empty, like the Tin Man. I had no way to communicate what was going on, no way to understand it." And I'm wondering if any of these words or sentiments reflect what you might feel, what family members might feel, or friends, others that you might have in your life, of just feeling stuck and unable to really talk about what is happening or convey or express it in any way outside of yourself. And what she was speaking to here really underlies the model that is the biosocial model that DBT rests on. I'm going to spend just a minute to go through this. This might be very familiar to some of you. It might be something that you haven't heard about before, so I'm still just going to give a brief overview. The reason why I think this is helpful is essentially what Dr. Linehan did and many other researchers at the time were trying to think about how can we conceptualize what's known as borderline personality disorder in a way that's actually helpful, and instead of just being given as a diagnosis, gives us a little bit of some insight into what might be happening with these individuals so that we can develop a therapy and treatment that responds to the needs, the individualized needs of these people. So what they developed is something called the biosocial model. Here on the left-hand side, you'll see a photo that I pulled from a website. You know, oftentimes I think I struggle a lot, and many others in the field struggle with the term borderline personality disorder. I think if we could choose other words, language, as we know, is very important. Would it be called something like pervasive emotion dysregulation? If we conceived of it as that, then we can think that maybe these individuals would respond better to an emotion-focused treatment. What you see here is what I highlighted and what DBT is in pursuit of, really being focused on emotions. So the biosocial model posits that these two things, emotional sensitivity and an invalidating environment, lead to emotion dysregulation. Just to give you a bit of a picture of what emotional sensitivity means, there have been some neuroscience studies done where some individuals who are born with a smaller amygdala, it's a part in your brain that processes fear and panic. That system, if you're born with a smaller one, might send you into overdrive, where you are more arousable, where you are reacting to stimulus in a greater or more expanded or expressive way than someone else who has an amygdala who might be of a normal size. So we think about how this interacts with your brain and how individuals many times are born primed with an emotional sensitivity. You place that individual in an environment then where there is neglect or abuse or harm. This individual never has the ability to develop skills to adequately regulate their emotions. So it's this combination, again, of being primed with emotional sensitivity, being placed in an invalidating environment where these maladaptive behaviors can occur. And so DBT assumes that clients are doing the best that they can, given the circumstances, and also that they need to learn new behaviors to change. She closes by saying, "I honestly didn't realize at the time that I was dealing with myself, but I suppose it's true that I developed a therapy that provides the things I needed for so many years and never got." And it says here, Dr. Linehan was closing in on two seemingly opposed principles that could form the basis of a treatment. Acceptance of life as it is, not as it is supposed to be, and the need to change despite that reality and because of it. And these two concepts of acceptance and change is really the underpinning of dialectical behavior therapy. So I'm going to just break this down and then I'll get into the evidence, and shortly I will turn it over back to Emily. So if we think about DBT and the three words that make it up, dialectical behavior therapy, it tells us exactly what we need to know about the structure. So what does dialectical mean? It actually means an integration of opposites. Here you can see an image where the therapist's stance should be squarely in the center, balancing change and acceptance. It's always a both and situation. And it tells us that reality consists of opposing forces that are in tension, and that we don't have to choose one side or the other, and that it truly is a balance. And this helps both the therapist and the client get unstuck from any extreme or rigid position. And I think really opens up conversation and the path to getting better. When we think about the B in DBT being behavioral, it does draw on some of other therapies, like I mentioned, like CBT. The main thing to know is that it's a skills-based treatment that teaches and reinforces effective behavior in an effort to reduce maladaptive behavior. Again, behaviors that have been learned outside of the individual's control based on circumstances that they might have been placed in at a young age. The big 4 skills modules, which Emily is going to dive deep into and give you concrete examples for, are 1, mindfulness, 2, distress tolerance, 3, emotion regulation, and the 4th is interpersonal effectiveness. And finally, the T in DBT is for therapy. As many of you might know, it consists of weekly 1-hour individual therapy sessions, a weekly group skills training session, and also a meeting for therapists to consult with one another as they're doing this work. And so typically you have what's called standard DBT, where it consists of all 3 of these components. And then there are DBT skills where we're really focusing on the 4 skills that I just mentioned earlier. So we're going to get into the evidence space really quickly, just for the next couple of minutes. So I just wanted to pose a question to all of you. I know that things might move rapidly with 450 plus of you here and in the chat, but DBT has been applied in a variety of settings for a range of conditions. And I'm just curious, what kinds of diagnoses, conditions, or situations have you seen DBT being used to treat, either in your personal lives or the lives of family or friends? All right, so I'm getting a lot of things here. So I've seen borderline personality disorder, post-traumatic stress disorder, bipolar disorder, general anxiety disorder, anger, mood disorders, bipolar 2, substance use, depression, schizoaffective disorder, complex PTSD, eating disorders. It can help with obsessive compulsive disorder, especially around delusions. It can help with transition age youth who are maybe unstably housed or at risk of losing housing. Premenstrual dysphoric disorder, otherwise known as PMDD. Wow, you all are covering all of it. I mean, what ODD has also been thrown out, oppositional defiant disorder. All right, so it sounds like to me that, as you can see, just from what we've collected from all of you, it can be really applied in a range of different settings. And what I'm going to show you is just telling you exactly what you've been sharing with me here. And I really thank you for all of your participation. Okay, I'm seeing questions pop up too. I'm going to save some of these for the end as well, just to make sure that we give Emily time, but I'll make note of it on my notebook that I have right next to me. But thank you. Keep the questions coming. And if you want to make sure we don't miss them, put them into the Q&A box so that they're highlighted for us and don't get lost in the chat. So there have been numerous studies on standard DBT, which include the 3 therapeutic components I've mentioned: individual therapy, group therapy, and therapist consultation. for individuals with suicidal behaviors and a diagnosis of borderline personality disorder. Now, there's a range of adaptations for skills training, DBT skills training. So it's eating disorders. ADHD is another one. I don't know if that was mentioned in the chat. Can be also helpful for bipolar disorder, which many of you mentioned. Also for treatment-resistant depression. And several more. Some of these are just some quick snapshots I put up. So it includes alcohol use disorder, substance use disorders. It can be helpful for interpersonal women who suffered interpersonal violence, trauma, PTSD. Also can be used for wellness and resilience in college. And then also for individuals dealing with distress and pain after a physical injury. So hopefully you can carry some of these skills that Emily is about to go through and share with us and apply it. I mean, I also apply DBT skills all the time, especially this mindfulness training that we started off with today, and find it extraordinarily helpful. So thank you so much for your attention. I'm going to pass things off to Emily.
Right. Thank you so much, Dr. Nguyen, for giving us such a great and stable and important build to what DBT is, explaining the science behind it, and giving us a real understanding of where it comes from, and a little bit about who Dr. Marsha Linehan is, because she is one of the amazing people who really put DBT together as it is today and has done a lot of research on it. So thank you, thank you, thank you. It's always such a pleasure to present with you. So I'm going to go on now. For those of you who are joining a little late, I just wanted to reintroduce myself. Besides being the director of the CBC Training Institute, I myself am a person with lived experience. And we can go to the next slide. So for me, it's pretty personal. This is a picture of me when I was in my 20s, probably at the height of my mental health struggles. I was diagnosed with bipolar disorder, bipolar 2. And also they were playing around with the borderline personality diagnosis, which is what won me a seat in dialectical behavior therapy. This is going back 20 years, and not to age myself, but I guess I just did. And it's going back 20 years. And in those 20 years, they have adapted the model to so many, as Dr. Nguyen said, so many other disorders. But in the beginning, it was really that they were thinking it was for borderline personality disorder. And because I was experiencing so much treatment resistance with the bipolar treatments that they were experiencing, and because they were thinking maybe there might have been some borderline tendencies, they decided to put me in this new type of treatment called dialectical behavior therapy. They did this after I had been hospitalized for both suicidal thoughts and also manic episodes, some psychosis where I was seeing and hearing things that weren't there. And I had been hospitalized in and out about 10 or 11 times at that point, a total of 12 times by the end of my treatment. And by the end of my treatment, they were really considering institutionalizing me. So in fact, while I was in the hospital, they came in and interviewed me for the institution. And I like to say that the way I got out of that was because I kind of lied through my teeth and basically just explained that I was fine, even though I really was not functioning very well in the community at the time. So at that point was pretty much a big turning point for me. I made a decision that I did not want to be in an institution for the rest of my life, which is what I was facing. And so I made a decision instead to pick up DBT and to learn skills. And that was the life-changing decision that was the turning point in my life. Did we lose the slides for a sec? Okay, here we go. They'll be back for us. So before we get started on my section of the presentation, I want to ask you guys a question, because DBT is all about building a life worth living, or building a life. I always like to say it's the way we learn how to manage intense emotions and deal with difficult interpersonal situations, aka how do we deal with difficult people in our lives. So I want to ask you guys, because it is a skills-based therapy. And so they teach you a lot of different coping strategies. And like Dr. Nguyen said, it's run both with an individual therapist and also in a group setting. And the group setting is not just a process group, meaning you sit around and you talk about the problems. It's run in a didactic setting, meaning that there's a teacher that is writing on the board, teaching you skills, and you are a student both taking notes and also doing homework on the skills. So before we get into what those skills are, I want to ask you guys a question. So we can go to the next slide, Dr. Nguyen. And my question is, DBT teaches clients a variety of coping strategies to manage intense emotions. And the question is, what coping strategies are you already using? And if you are a mental health professional on the line, what do you teach clients? So if you guys could chat in the chat, what coping skills are you already using? Mindfulness. Oh, the 5, 4, 3, 2, 1 grounding game. Love that one. Radical acceptance, deep breathing. Oh my goodness, they're coming in from all over the world. Journaling, guided imagery, personal medicine. Ooh, Pat Deegan with the personal medicine. Love that one. I teach mindfulness and deep breathing. Amazing. Alternative rebellion, craft making. Keep them coming. 5-finger breathing. Distraction, like being present in drinking a cold glass of water. Poetry. Oh, someone does SNL, watches videos for distraction. So there's so many great ones that we can do. And what I love, thank you everyone, validate, validate, validate. Yes, these are awesome. So what I love is that DBT really teaches us some coping skills that we already know, but some that are a little out of the box, and really helps us to put it all together so that we can apply it to our lives. So we can go to the next slide, Dr. Nguyen. DBT has 4 core skill parts to it. So 4 sections essentially. And I'm going to talk you through the sections. One is mindfulness, which is what we did in the beginning of this presentation, becoming aware of your thoughts and emotions, observing yourself without judgment, and also being in the present moment. Distress tolerance is how to deal with difficult situations, how to cope with pain. I always say distress tolerance is for when those emotions are red hot, because I don't know about you guys, but my emotions can get red hot sometimes. I just feel them so intensely, and I need something to do about that. Emotion regulation, and that's where we learn how to manage emotions, change unproductive emotions, and create positive emotions. And then those interpersonal effectiveness skills, and those are the ones to help you deal with the difficult people in your life, asking for what you want, saying no, and managing conflict. And it helps us to create relationships and not destroy the ones we already have. Okay, we can go to the next slide. So what we're going to talk about today is I'm going to give you a sample of skills from each one of these 4 sections, and I'm going to tell you how I've used this skill in my own personal life. So I hope you find that helpful to you all. We can go to the next slide. Okay, so the first section that I referenced is mindfulness, being in the present moment. In order to be really in the present moment, we want to get from our emotional mind, which is, if you guys are Star Trek followers at all, Captain Kirk was often in his emotional mind. And this is where reason and logic and thinking in a logical way is really difficult because we are flooded out emotionally. We're only making decisions based on our emotions. We're reactive. And then there's the rational mind. The rational mind is more like Dr. Spock or Mr. Spock. He was very logical. He always thought based on the facts only, and uses facts and research to plan out his next move in life. Now, both of these places are not necessarily the best place to make a decision from. What we want to do, and the reason is if you're just making decisions from your emotional mind, chances are you're making a decision that could be a little impulsive or could be, you're not thinking it through very carefully. But if you're always making decisions without emotion based on your rational mind, you're gonna really struggle also because you're not taking any emotions into consideration. We want to make decisions based on our wise mind. And the wise mind is that inner intuitive thinking that we have. It's a balance between the emotional mind and the rational mind. And it comes from a deep, wise place in your core that I believe we all can get to when we learn how to practice mindfulness correctly, when we learn how to be just in the present moment. So that's the wise mind, rational mind, emotional mind explanation. We can go to the next slide. Okay, so one way that we can manage our coming back to the present is something that I like to call, and this is a mindfulness skill, called thought diffusion. And I'm going to show you a video on thought diffusion in just a minute. There's lots of different metaphors that really explain what thought diffusion is. One of them, I like sushi. Not everyone does, but I'm a sushi fan. So I love this sushi train analogy of thought diffusion. There's also another analogy of it that has to do with Lucy and Ethel from I Love Lucy. So I'll explain what it is first, and then we'll watch a little video about it. So thought diffusion is learning how to basically see your emotions or observe them without getting attached to them. So it's observing emotions and letting them pass, much like the way clouds pass in the sky. It's letting intense emotions and thoughts pass without getting attached to them. So I'm going to now show you a video that we have closed captioning for, and we're going to learn more about thought diffusion. So hold on one sec as I share my screen. Hold on one sec. I just have to hold on one sec. Sorry about that. I just have to.
So imagine that you're sitting in front of a sushi train at one of those Japanese restaurants, and there are all these dishes going past on the train. And in the center, there is the chef creating all of these dishes. The chef is like your mind, and the dishes are like all of those thoughts, ideas, memories that keep cropping up, coming and going all day long. Some of the dishes on that sushi train may be very appealing. Some of the stuff on that sushi train may be unappealing. And some of it may be neutral, take it or leave it. And it's much the same with our thoughts, memories, ideas that pop up throughout the day. Some of them are very pleasant, we really like them, we want to hold on to them. Some of them are very unpleasant and we just want to turn away from them, get rid of them. And a lot of them are kind of neutral, they're neither positive nor negative. So all day long, the sushi chef of our mind is creating all these different dishes, and the train keeps carrying them round and round. These thoughts keep cropping up throughout the day. Now we can learn to step back and watch our thoughts coming and going in much the same way that we can step back and watch that sushi train. An unpleasant dish pops up on the train, we don't have to turn away in disgust and horror. A pleasant dish comes by, we don't have to reach over and grab it and stuff it down our mouth. And we can do the same with our own thoughts. We can step back with an attitude of openness and curiosity and watch them come and stay and go in their own good time.
Okay. I'm just going to give a minute for the slides to come back up. Thank you so much, Dr. Nguyen. Okay, so how did I use that skill? I remember so well in the beginning of my DBT classes, I would leave afterwards and I would literally lay on the ground and look up at the sky. And every time I had a thought, I would picture it like it was one of the clouds in the sky. I would picture the thought like on the cloud. So if I was having a thought about, I don't want my car to get towed, I would picture the car on a cloud. And then I would let it pass. I would watch as the cloud went by, and I would let that thought pass without getting too attached to it. Because what happens when you get attached to a thought is that the thoughts get worse and worse and worse. So then it speeds up and goes faster and faster in your mind. And thought diffusion is about just letting the thoughts go without judging them or getting attached to them. Okay, we can go to the next slide. All right, so now we get to interpersonal effectiveness. And this is a skill that I use very, very often, especially when I was first in treatment. I was in a difficult relationship. And so I was often using Dear Man with the person I was dating at the time. So Dear Man is a way of getting what you want in a very civil way. And it's also a way of saying no to unwanted requests. So I also use this skill in my work life a few times to do things like ask for a promotion. So it can be used in so many amazing ways. It does take some practice, which someone is saying in the chat right now, but it's a really, really powerful skill. And I'm going to describe exactly how it works. So describe is the part where, so you'll notice that every letter of Dear Man stands for a word. So D stands for describe. Describe is where you explain a situation that's giving you trouble or a hard time. So I'm going to give you a big example, and then we're going to break it down into Dear Man. So let's say that my boyfriend throws dirty socks near the hamper, but doesn't ever make it in, and they're all over the floor. Okay, so D is where I would describe when I sit down with my boyfriend the situation. And I would say something like, I notice that there's laundry on the floor. I'm describing it very objectively. I'm not judging it. I'm just saying to him, you know, there is laundry on the floor. Express is when you tell the person how that makes you feel. So I might say something like, when laundry is on the floor, I feel disrespected because there's an expectation that I'll pick it up when I do the laundry, which makes extra work for me and a mess in the bedroom for both of us. Okay. And so, yeah, and someone is saying I statements. So you are, which is what I kind of just did. When blank happens, I feel blank. And it's not saying you put laundry on the floor and it makes me feel bad. It's saying, I notice there's laundry on the floor. When laundry is on the floor, see what I did there? When laundry is on the floor, I feel disappointed, distressed, angry, whatever it is. And you explain why. Now, this is the hard part, the next part. The A is for assert. And assert is where you explain what you want. And that's really hard for a lot of people. And it's very simple, but very hard for a lot of people. It was hard for me. But I would say something in this example, like, I would like you to throw your laundry in the basket. It sounds so simple, but it's really hard to do sometimes, is ask for what you want. The R is for reinforce. I know that if you do this, I won't feel resentful and our relationship will improve because I'm not harboring resentment. So you tell the person how things are going to change for the better if they do what you want, basically. So now that's the dear part. The man is there because this request does not happen in a vacuum, right? There's two people in the conversation. So you're going to give your dear and you're going to explain it in the best possible way, and they are probably going to push back. When they push back, you want to appear mindful, confident, and be willing to negotiate. So being mindful is really staying on topic. They might say, yeah, but you make a mess in the bathroom all the time. And you can say, I understand, but I'd still like you to put your laundry in the basket. So you kind of redirect them back using a broken record technique or saying the same thing over and over again. They might say, yeah, but you have cats and their hair is dirty and all over the place. And you can say, I understand, I'd still like you to put the laundry back in the basket. And if you do this in a way that you appear confident, and looking them right in the eye, not slumping down or anything like that, appear confident, look them right in the eye, and then be willing to negotiate. You might say something like, if you put all your laundry in the basket, I'm going to be willing to wash it. So, which is a very nice thing of you to say, but that's an example of negotiation. So that's the dear man strategy. We can skip the next slide, Dr. Nguyen, and go to the slide after. We can go to the yes. So the last slide that we just skipped, we skipped in the interest of time, but it was just a little bit of giving an example of dear man, which I did for you already. So the next skill is under the heading of emotional regulation, which again is the third type of section of DBT. And this skill is helping us to manage and regulate our own emotions. It's called opposite action. And it sounds really obvious, this opposite action, but it really, really works. So for example, when you're feeling angry, you might have this urge to verbally or even physically want to attack someone, right? That's what anger does to us. It makes us boiling and wanting to hurt someone with our words or our fists or whatever. The opposite urge is to be polite, more gentle or nice. And this is super hard. But when we do it, we're not feeding into our own anger and making the situation worse. For anxiety or fear, our urge is to avoid the anxiety-provoking situation. And I was someone who was at one time agoraphobic, meaning that I didn't want to leave the house. And so I was avoiding everything. And the opposite urge is to remain in the anxiety-provoking situation or even expose yourself to the anxiety-provoking situation. So I had a saying for myself, which is I go out to get well. And this is not original. This is something I learned in another support group called Recovery Incorporated. At the time, now it's Recovery International. But they have a saying there that says, you go out to get well. You don't get well to go out. And what that means is if I were waiting for my bipolar to feel better before I went out and saw people and left my apartment, I would never get well. So doing the opposite of what I wanted to do, I was feeling anxious all the time and I wanted to just curl up in a ball and stay in my bed. I had to do the opposite emotion, which was going out. So that was my mantra. You go out to get well, you don't get well to go out. Sadness is another time that often I wanted to isolate myself from others. That was my urge. But the opposite urge is to seek support and socialize. So again, these are not easy things to do. They sound like, oh, that's going to be so hard. But once you do it, it has an immediate positive effect. Another one is shame. I want to hide from people or avoid them. And instead, I approach others and, if appropriate, share my thoughts. So opposite action is literally doing the opposite of what your feelings are your emotions are telling you to do. And that often works to help you feel better. Okay, we can go to the next skill, the next slide. Okay. So I'm just looking at time here. The next series of skills are under distress tolerance. And distress tolerance, again, is when emotions are red hot. So when I was first coming to DBT, I lived in distress tolerance skills because they were the ones I needed the most. My emotions were always red hot. As I told you earlier, I was dealing with a lot of thoughts of harming myself. I was dealing with a lot of intense emotions. So I learned about distress tolerance, and these are ways to really distract yourself using what they call skills. So here are some different skills. They say it's the accept skill. And as you saw in the earlier in Dear Man, every letter stands for something else. They do that a lot in DBT to help you remember things. So A is for activities. Engaging in activities that you like. So I'm feeling red hot emotions. I'm going to engage in activities that I like to distract myself, whether it is, I remember I was in a fight with my boyfriend, and I'm going back 20 years to when I was learning DBT. And I decided I was going to make him an apple pie. And I decided that because it used so many skills for distraction, right? I had to, for any of you who have ever made an apple pie, you have to roll out the dough, you have to slice all the apples and, well, first you peel all the apples and then you slice them down. And so there's lots of different things to focus on in the present moment. And that was an activity that really helped me to distract myself from very, very intense emotions. So that's what activities are. And there's so many of them: knitting, reading, playing with children, petting your animal. Contributing is doing something for someone else. And this is a skill that has helped me time and time again. Whenever I've struggled with intense emotions, getting out of my own mind and helping other people is a very quick way to do it. So whether it's helping someone cross the street who needs help crossing the street, whether it's calling up someone that really wants to receive my call that I haven't gotten around to calling, whether it's now trying to help people in need. I know
one moment, sorry, Emily, you cut out for a moment. Can you just say that last sentence again?
Of course, sorry about that. So I'm just looking at my bandwidth and making sure I'm okay. Yeah, so am I back?
Yes, you are.
Okay, great. Thank you. Okay, so whether it's contributing, whether it's helping other people in some way, making a phone call to someone who you really feel needs support in Hurricane Ida, helping people that are going through a hard time, whatever it is, contributing is really, really helpful to folks. Comparisons is really thinking about a time in your life when things were worse and thinking about now as it relates to that time and realizing how far you've really come. Emotions is generating difficult emotions than the ones that you're feeling. And to do that, there's so many different ways. But for example, if you're sad, watching a funny movie can really help. If you're feeling angry, listening to some calming music can really help you to bring that down. So generating different emotions than the ones you're feeling. Pushing away is putting the problem on a shelf. It's actually saying, for the next 5 minutes, I'm not going to think about this problem. I know that's hard, but the way I do it is through what I call a breathing vacation. I set a timer, and for 1 minute, I say, I'm just going to focus on my breath, and I'm not going to focus on my problem. And for that whole minute, every time my mind wanders to the problem, I bring it right back to my breath. So that's how I push away sometimes. And we don't want to always push things away, but when you need a break, that's a really good skill. Thoughts is engaging in thoughts that compete with the ones present during the crisis. So for example, I'm having a crisis. I might remember back to a time when I was happy in my life. I might remember back to that time that I was in Central Park, and I don't know if any of you have been to the boathouse in Central Park, but it's a beautiful boathouse, and there's you can row a boat, and I know I'm going out there a little bit, but so I remember a really wonderful time when I was rowing my parents in a boat and we were laughing together. That's how I might take my mind off of the current crisis that I'm having. And then sensations, using the 5 senses in order to ground yourself. And I saw someone said the 5, 4, 3, 2, 1 skill. What that is you find 5 things that you can smell in the moment. You do 4 things that you can taste if you're eating. You do 3 things that you can hear. You do 2 things that you can see. You do 1 thing that, you just use all of the senses that you have available to you to really bring down your intense emotions. So we can go to the next slide. Okay, so under distress tolerance, there's another skill that I really want to talk to you about. And this is the last skill that I'm going to mention today. And this is called radical acceptance. And what this talks about is many times when there is something really upsetting in life, it's always going to be upsetting. Pain is a part of life. But we sometimes suffer. And suffering happens when we reject reality. We think we can change reality by saying, no, this is not happening to me. But really, we only make things worse. We go from pain, which is really a part of life, emotional pain, to suffering. And suffering is that pain that goes on and on and on without passing. Pain will always pass. Suffering sticks with us. And again, suffering is feeling emotional pain plus not accepting that we're feeling emotional pain. So I know this is a big idea, but radical acceptance is really learning how to accept a painful situation. We're not judging it as good by accepting it, but we are helping ourselves to not suffer over it. And so I'll give you an example. When I was first diagnosed with bipolar, and they thought perhaps I had borderline personality disorder as well. which, by the way, resolved itself after I used DBT. So it wasn't something that I really was experiencing. It was that my bipolar was so severe that I was showing signs of borderline personality disorder as well. But anyway, when I was first diagnosed and they hit me with all these diagnoses, I was really, really upset. I was not able to accept it. And so I wasn't just feeling emotional pain about it, I was deeply suffering. And I don't know if any of you have experienced something similar, but it is hard to accept a behavioral health diagnosis in the beginning. And so it was little by little, I learned how to accept it. And once I accepted that not only did I have this diagnosis, but that I was being given skills to learn how to manage it, I made a decision to accept it, and then the suffering went away. I was still in pain about it sometimes, but the suffering went away. And once the suffering went away, I made a decision. And that decision was that I wanted to help people like you, if you are someone who is struggling with mental health. I wanted to help others by teaching them that recovery is 100% possible. And I could not have done that without practicing radical acceptance. And also without using the other DBT skills to work on the very beginnings of my recovery. So I hope that you guys can learn more about DBT, because DBT really brought about a wonderful recovery for me that was beyond any of my imaginings. I mean, if you told me today that I could even have a job beyond the fact that I am doing exactly what I love, which is bringing you guys trainings on mental health and training mental health professionals. If you told me that many, many years ago, I would have not ever believed you. If you told me that I was going to be living independently, having a wonderful life worth living, I would not have believed you. And so I want to tell you that DBT really, really, really works and can make dramatic shifts in people's lives, as it has in mine. But the key is really practicing the skills. They're not easy skills to practice, but little by little, if you make them a part of your life, they can certainly transform things. So I want to show you a couple of resources now. We can go to the next slide. So one of the things in DBT is something called a diary card. And a diary card is where you write down every day that you've used the skill. And the reason why it's important to watch every day when you've used the skill is because, and you'll see some of the skills here. So it says wise mind, Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, Sunday. So let's say I used wise mind on Monday. I would circle that. And every time I use a skill, reminding myself that I used it is super important, because using the skills does affect your mood in the positive, but it's hard to remember in the beginning that that's really what's happening. So this is data. And we can go to the next slide where we can see the other part of the diary card. So with this part of the diary card, you write down, for example, if you have the urge to, SH stands for self-harm. So if you had the urge for self-harm, you write down on a 0 to 5 how strong that urge was before you use the skill. And then you look and see after you use the skill how strong that urge is. So usually it goes down. And that's what's so amazing about it. And you also can look at your emotions. I'm feeling shame. Before I use the skill, how high is the shame? And after I use the skill, how high is the shame? And this data really helps people to look back and see where the skills are working, because it's very subtle in the beginning. It doesn't always shift right away. And this diary card, I'm going to show you where it came from so that you guys can print them out, and show you a lot of other things too. So all of this came from a website called Dbt Self-Help. This is a website by a woman who uses DBT herself and created this website where she has basically all the skills written out. On the left-hand side, you'll see DBT skills defined. She has all the DBT lessons that Dr. Marsha Linehan has taught. She has under everyday DBT is where the diary cards are. So you can go under on the left-hand side where it says everyday DBT, and you can get the diary cards. And we're gonna share this link, as Clara is saying in the chat, in the post-event email as well. So this is a really great resource, and that's where the diary card came from. And I see Rose is saying I use that all the time. I'm so really glad about that, Rose. Okay, we can go to the next slide. So if I had to sum up my experience with DBT in one quote, I would say it's, you can't stop the waves, but you can learn to surf. So DBT is like learning how to surf over the waves of your emotions. When emotions come, they're like a wave. They have a high point and then they pass. The skills help you tolerate that very high point of your emotion so that it doesn't get worse and worse and worse, so that the emotions pass faster. It doesn't make emotions go away, but it helps you to tolerate them because emotions pass on their own. Believe it or not, I did not believe that one bit, but they do pass on their own when you tolerate them. So I really wanna thank you guys so much. And I wanna thank Dr. Nguyen as well so much for being here today for this presentation. I know we're gonna answer some questions if there are questions from folks, but I really wanna leave you by saying that this really, really works. It takes practice and grit, but it really, really works and it can change your life too. So I know we may have some questions, Clara. Let's see what they are.
We sure do.
Hey.
And I'm sure you can see this in the chat as well, but a lot of just gratitude and appreciation coming from attendees. So I'm really grateful to all of you for being here and really glad that it was useful to at least some of the folks here. We've got a lot of questions, so we're gonna see how many we can get through. The first question, there were a couple of variations on this question, but can you talk a little bit about the difference between dialectical behavioral therapy and cognitive behavioral therapy? And the person also asked about REBT, and I'm not sure if that's something that, an acronym that you're familiar with.
Dr. Nguyen, do you want to take this one or?
Sure. I don't know if my video should be pinned just so then it's there. Hello, everybody. So thank you for the questions. The question is, what's the difference between DBT and CBT? Both are pretty skills-based. Both think about thoughts. I think the difference is really one in how it's structured. So having the group therapy, definitely that is different. The diary cards are also very similar. You can find both of them in CBT as well. I think the thing that sets DBT apart are the 4 skills that Emily went through that makes it very concrete in terms of the mindfulness, distress tolerance, interpersonal activity, interpersonal effectiveness. Otherwise, I do think that that helps focus the treatment, and it also helps you think about larger issues and areas and problems in your life. I think sometimes CBT can feel more focused and kind of pinning you to one recurrent thought that you might be having. Whereas I think DBT does a really great job of thinking about everything and how you are interacting with those around you. I think both can be extremely useful for different circumstances though. So I won't say that one is better than the other. I think it's really dependent on the situation that you're in. In terms of rational emotional behavior therapy, REBT, I don't have any personal experience with that. I would love to hear more from those here who've had experience and can share. I don't know, Emily, if you've had any experience or training in it, but it's just not something I can speak to.
Fair enough. Oh.
One more thing I'll say about CBT is that usually it's a short-term therapy. So it's usually best used when it's 6 to 8 weeks and you're thinking about one circumscribed problem, whereas DBT can be done over a number of months and the skills can be used all the time.
So I want to skip there's a couple of different categories of questions. Can you talk a little bit about a couple of folks mentioned situations where DBT, they did not feel that DBT was quite the right fit, or was not working for them, or was not working for someone that they were working with. Perhaps this is outside of the scope of this particular presentation, but I'm wondering if you can speak about situations in which DBT might not be appropriate and what alternatives might be, particularly in regards to borderline personality disorder, since that's often there's an association there.
Emily, I'd be curious to hear what you'd say. I think off the top of my head, there is another therapy that is recommended that's called TFP, Transference Focused Psychotherapy. That is much more of a relational therapy that happens between an individual and their therapist. It's less skills-based and it calls out what is happening in session. So it relates the relationship you have with your therapist as a mirror image of what might be happening with individuals around you. So then you can start applying those skills in real time. And it also requires a number of different things, not exactly contracts, but like a meaningful work requirement, for example. That is something I think that's not always required for DBT. So that is something that could be used. I think I'm curious as to what people's experiences are. I think it's very individualized in terms of why DBT might not work. Could be just not a right time in your life. I think it can take a lot of time and commitment to do, individual and group therapy, but curious to hear what Emily has to say.
Yeah, so DBT, as much as I love it, it's not like a cure-all for everything, I know why I loved it. And the reason I loved it was twofold. One was because I was tired of just laying on my therapist's couch in a psychodynamic way. Not that I'm against psychodynamic therapy by any means, but I was doing I felt like I was complaining about my problems week after week. And when I left the therapist's office, I didn't have tools or skills to manage whatever came up after the therapy session. So what I loved about DBT is it gave me agency. It gave me the ability to manage my own emotions without needing to be in front of my therapist to process something. I will say that for folks with a lot of trauma history, there are other therapies that address that. And I often get asked, why didn't you just address your trauma first? And the reason why I had tried to, but the reason why I didn't is because I needed to have a foundation of skills first to deal with my trauma when I was talking about it. So for example, let's say I was talking about something very difficult and traumatic with my therapist. I needed a way to leave that therapist's office and ground myself with coping strategies again. And if I didn't have that solid foundation, it was a lot harder to process trauma. So, it's, and I see someone saying it's typically not recommended to process trauma and that kind of thing until you have strong coping skills. So DBT is that. The other reason I loved it is because I liked homework and skills and practicing, and I liked taking notes. I found it very refreshing from just sitting in a group and processing my problems every week. And so that's what I liked about it, but some people don't learn that way, and so for people that don't learn in that fashion, it's not necessarily geared towards all types of learners all the time. So I could see a lot of reasons why some people may not like it as much as others, but for me, it was just really an incredible life-changing experience.
Dr. Nguyen, can you repeat the name of the therapy that you had said at the beginning of your answer?
Sure, it's transference focused psychotherapy. I'll type it in the chat.
Perfect.
And send a link.
So there were several questions about situations, more detailed questions about situations where DBT might be applicable. So I'll go through a couple of those. Can DBT be used for schizophrenia or schizoaffective disorder, or sort of in relation to psychosis? And does it work for all ages? Can it be used for children? What's the age range where it can be applied?
I think this is where the beauty of DBT is, and that at the beginning we had talked about how there's standard DBT and then application of the skills. I think application of the skills that Emily walked us through can be applied in any setting, and really you can just pick and choose what is most helpful to you. It's probably the most straightforward answer I can give you. In terms of the evidence base, I don't know off the top of my head in terms of treating primary psychotic disorders, but I do know that I personally use DBT skills with clients from all different backgrounds, and they have found it helpful.
And I can say anecdotally again, I don't know the evidence base, but I was experiencing psychosis when I was in DBT, and it still really helped.
I'm sorry, did you address the question about the age range where this can be applied? I was looking at the question, so I didn't quite hear the full answer.
I think we probably apply DBT skills to kids all the time, right? Like taking time away from something, pausing when you're doing something, when you're feeling distressed. All of those are coping strategies. And so I think it certainly has been used with individuals in a more formal setting, with kids in a more formal setting, but I think it can be applied at any time.
Yeah, Dr. Alec Miller is doing a lot of wonderful research on using DBT in schools, which I think is so amazing, because if I can get on my soapbox for a minute, I wish I had these skills when I was younger so that I could learn how to manage my emotions at a younger age. So.
Great. So there have been a couple of questions about folks that may be resistant to some of these ideas, or resistant to DBT in general. And I'll start with something I think is a great question. When someone has lived with a diagnosis for decades, how would you help them to believe that some of these skills will work, and how to put in the effort and to put in the effort?
Do you want me to start on that, Dr. Nguyen? Okay, so I think number one, that's why diary cards are super important. Because when I never believed, because by the time I got to DBT, I was, I think, 7 years into my diagnosis, and was really living a very, very, a life where I wasn't functioning very well. And I mean, I could barely be maintained in the community. And when I learned these skills, I just didn't believe that they would work at all, until like I had a diary card in front of me, and you know, when I talked to my therapist, she would say, I want you to try X skill when you're going through whatever problem you're having. I want you to try Dear Man. And I would try it, and then I would mark down the days of the week that I did Dear Man. And on the other side of the card, I would write down where my emotions went, like on a scale of 0 to 5. How angry was I before Dear Man, and how angry was I after? And so I couldn't argue with the evidence, which was that I was less angry after doing Dear Man, let's just say. And so having that data to put in front of someone, because it's subtle in the beginning, it doesn't just like give you recovery right away. So having that evidence in the beginning, I think is super important. I think also this is why it's important for peers to be involved in DBT provision, which is not part of the evidence-based model yet, but I hope it will be, because a person with lived experience who's had 7 years of struggle and has come out of it is a much better person, no offense, Dr. Nguyen, to be able to sell DBT to someone else than someone who has learned about it in school, you know? And so that's where peers are really powerful in terms of the mental health provision in general, but also I think can be a really big help with DBT.
I have
So
nothing to
anyway, I'll
add.
turn it over to Dr. Nguyen.
No, I have nothing. I mean, the only very small thing I would say is I think for many reasons, some people might not be receptive to hearing that they're getting this manualized treatment or like this huge package, and it might just feel like too much at one time. And so then I think it's up to someone's discretion of what you want to choose from and pull from. And you don't have to say, you know, now we're embarking on a DBT journey if someone's not ready for that. And if they find 1 or 2 skills helpful, then that might be an impetus or provide a beginning to starting out using more and more skills.
Yeah, absolutely. Can you talk a little bit more about, I'm sorry, I lost the question. Where did it go? Can you talk a little bit more about the process of letting thoughts go past, letting thoughts sort of go without and not forcing them to resolve? The person who asked this question said, I tend to overthink everything, but it also does help resolve things. But how can you sort of, what would be a different approach for that?
Right. So I used to think that my thinking mind was what resolved things too. Meaning that I had grown up like relying so much on my brain to solve everything. The problem with that is that it's exhausting after a while to try to think your way out of every problem. And, you know, generally, you know, I definitely don't want to get spiritual here because I don't think it's 100% the venue for that. But I do feel that whatever you believe in, whether it's the goodness of the world, whether it's a higher power, whatever it is, there are forces at work that can help things work out, you know, and we cannot control every little piece of the puzzle of the universe. And so I think that, yes, thinking things through is really important, and there's an important place for that. But there's also an important place for letting things flow in whatever way you're able to let them flow. And things work out well that way too. So often I find that if I'm stuck in one of those rabbit holes where I'm thinking and thinking and thinking and thinking, I just give it a rest. I literally have to say to myself, the last time I tried this, did this 100% work for me? And chances are I'll remember a time before when I kind of let it go a little and let things just flow and work out for themselves in the best possible way. I do think there's a place for planning, and I think the mind is a very useful mechanism, but I also think there's a place for letting go.
We are coming up on the end of our program, but we have some time for a couple more questions. And a couple people have asked about how to find a DBT provider if they're looking for that. If they've heard this presentation and they're feeling very convinced, they want to give it a try, what would you recommend? Particularly if somebody has a specific kind of insurance, if they have Medicare or Medicaid, you know, can you speak a little bit about the process of finding a provider who is who can teach some of these skills?
Go ahead, Emily.
I was just going to say that on Dr. Marsha Linehan's website, which is the behavioral tech website, which I'll put in the chat in a minute, there is a search engine where you can search for DBT therapists. That's the fastest way that I know. I also know that when you look in search engines such as Psychology Today, for example, you can put in the specialty that you want and you can check off DBT and you can check off the type of Medicaid or Medicare or whatever your insurance is. I also have a feeling that NAMI could be helpful with that, although I don't want to put that on NAMI, but those are some ideas that I have about how to find a DBT therapist in your area.
I would just include that not all providers might write down that they are DBT therapists because they might provide many different types of therapies. And so I would just encourage you to ask the provider that you are seeing currently to state that you're interested. And, I think it does depend on if you are looking for kind of a more formal DBT environment or you just like to learn more about the skills and have someone walk you through it. Because I think many providers of all different training backgrounds have varying experiences with it. So I think to be able to ask and have a very candid conversation, to what degree do you feel comfortable with us? To what degree have you had training in this or knowledge about it?
There were a couple of questions about the group component. Oh, I'm sorry, Emily, did you want to add something to that?
I just wanted to say I just put the behavioral tech link in the chat where you can go on and find a DBT therapist. That's Marsha Linehan's website. I'll put it in the chat one more time because I see a lot of things are jumping around in the chat, but the behavioraltech.org resources find a therapist. That's Marsha Linehan's organization where you can look for DBT therapists through her.
Amazing. Yeah, there were some questions about the group component as well. Is that a required component if somebody is more comfortable with the idea of doing this individually, but is not excited about being in a group setting? What is their flexibility with that?
So there are all different types of people doing all different iterations of DBT out there. Treatment adherent DBT does I'm sorry, I think that's what it's called. Anyway, if you were to want to become a DBT therapist via Marsha Linehan, that model does always involve group and individual therapy. And also the opportunity to reach out to your coach in between sessions via text or email as well, or calling as well for coaching calls, which are really helpful. I can't talk enough about how great it was. I was not a believer in groups at all. And I can't say enough about how great the group was because it really gave me an opportunity to hear how other people were using the skills. And it became like a big think tank for how to use these skills in creative ways. But I understand that that's not for everyone. So yes, there are therapists doing DBT in all different types of fashions and ways.
So our last, we've just hit 5 o'clock here where I am in New York, but there's one more question which I think is a really fitting one for us to end on, which is, are there DBT skills that you recommend that can help family members or loved ones, someone who is supporting somebody who's, dealing with a mental health issue? And how can a family member or loved one best support someone who may be starting using some of these skills themselves? Two-part question. I can repeat it if you need.
No. I got it. Is it okay if I start with this one?
Please, go ahead, Emily. Yes.
Okay, so I want to tell you all that very recently, like in the last year, a very dear friend of mine who shall remain nameless went through DBT. And this friend of mine and I have become partners for each other in using skills. So how that works is like, let's say I'm having a hard day. I can call this very dear friend of mine and say, I'm having a hard day. Can you just talk me through some ideas of skills that have helped you with X situation? And or even better, I often say, these are the skills I'm going to try today. I don't want to, but these are the skills I'm going to try today. And can you please coach me through, like, are those skills a good idea? And she'll say, that's a great idea. I love those skills. And we encourage each other in that way. So that's having accountability, whether it's a family member or even better, someone who's going through it themselves, is amazing.
One thing I'd add is I have had individuals share that list of activities. So thinking about the ACCEPTS acronym that Emily shared with us around distress tolerance. And so making like a published list available and sharing that with close friends and family can be extremely helpful. And to just be able to kind of pick one off and have people be in agreement that they would partake in that and support you in it. No questions asked, I think can be extremely useful.
Fantastic. So with that, I know there are more questions, and I'm sure we could keep talking about this for quite some time, but we are at time, so we are going to have to end. Again, thank you so much to all of you, for all of our attendees, for being here. Many of the resources that were shared in the chat, as well as the slides and the recording, will be shared to everyone who registered, and you're welcome to forward along that email to anyone else who you think might want to watch the presentation or who might benefit from some of the information. But just a really huge thank you to our presenters today for being so thoughtful and thorough and clear. This was really great. Thank you to our interpreters for helping us continue to make these events more accessible. We are having another presentation in a few weeks on motivational interviewing and those skills for loved ones, which I think in some ways is a complementary skill set to some of these DBT skills. So please keep an eye out for that. And just thank you all so much for being here. Emily and Dr. Nguyen, do you have any final thoughts or words that you would like to share?
I can just say, first of all, I want to thank everyone so much. Our interpreters, Clara for putting this together, June for doing the tech support, and thank you to my very dear colleague, Dr. Nguyen. It's always such a pleasure presenting with you. And I want to thank all of you for being here today and for taking this information in. I hope that some of you found it useful and it really can change your life. So I hope that you will consider it if you haven't already. And I guess the last thing I want to say is that CBC Training Institute does free training for mental health professionals on self-care. So if you are interested as a mental health professional in signing up for any of these free trainings, my email address, I'll put it in the chat, but a lot of things are running through the chat right now. Perhaps Clara can share that in the exit email to all of you, so that if you're interested in getting our training calendar, we can certainly send it out to you all. And I'll turn it over to Dr. Nguyen for any final words.
Thank you for staying 5 minutes over with us. This has been such a joy. Thank you to Emily Ditto to everything she said. And it has been such a wonder to work with these interpreters. And big shout out to NAMI and all the work that you do and all of you who've been able to be with us today. We really appreciate you.
Thank you so much, everybody. Stay safe, and hope to see you back here again soon.
Bye, all. Take care.